In a 2021 article, Mental Health by the Numbers, written by the National Alliance of Mental Health Illness, 1 in 6 children ages 6 to 17 suffer from mental health disorders each year. This is why I feel mental health should be taught in public schools core curriculum. And it should help bring awareness to a topic many young people are suffering with. It's a prevalent topic because most of us have young children in our lives, whether it be our own kids or siblings, or if you work with um, young kids. I personally work in the mental health field at a residential psychiatric treatment facility, and I see firsthand the effects that mental health illness has on the younger population. I've also done research on the statistics and why it should be taught in public schools. The reasons I think it should be taught in public schools is because it can bring awareness to the topic, it can teach the young adolescents about the different tools available, and it can also possibly decrease the number of children suffering from these illnesses and diseases. My first point is that it can spread awareness. Most of us know that it's happening around us, but we don't know to what extent. And the article Children's Mental Health Statistics, written by the Children's Society, 50% of all mental health issues start around the age of 14, and that's a huge number. Talking openly about something that so many young people are suffering from can help them voice their own concerns and hopefully get help sooner. And it stated in the Mental Health by Numbers article that suicide is the second leading cause of death in young people ages 10 to 34. And the Brain Forest Centers uh, wrote an article that state in 2019 that stated that it was called "Why Mental Health Should Be Taught in Schools," and it stated that suicide is the third leading cause of death in ages 12 to 24. And that statistic right there just shows the severity of the issue. 75% of children who are struggling with mental health are not getting the help that they truly need. And this was also stated in the Children's Society article. And talking about mental health openly and providing a basic understanding of what these children are going through it can possibly provide help to those who are suffering. My second point is the tools available. There are so many tools available that a lot of young children don't know that they have access to, such as support groups. With the technology advances, there are a lot of free support groups that you can attend virtually. But there's also a lot of local safe support groups as well that are ran by licensed and trained professionals. And schools could help provide a list of local safe support groups for children to either attend virtually or in person if they have the means to get there. There's also hotlines available to contact in a pinch. We are taught in school about 911, poison control, and our local emergency contacts, but we're not taught about mental health hotlines. There are free national hotlines and also local free hotlines, and schools could also provide the local hotlines as well. And then there's also the issue of communicating with parents. Unfortunately, usually getting help for mental health is not free, and most of these kids will be on their parents' insurance, and dependent on their parents. So being able to communicate with their parents will be very important. Providing support when they do so, whether it be by the school social worker, therapist, or counselor, could be a great tool for them to access as well. And my third point would be it could possibly lessen the cases. Um, in an article written in 2020 called Why Mental Health Education is So Important, written by Joe McLean, he states that when being taught about mental health at an earlier age, this allows for earlier intervention. And earlier intervention can sometimes prevent major mental illnesses because you can look for early warning signs such as like apathy and major mood changes. And when help is given sooner than later, it can avoid like major consequences. Also, if it's taught in school, they can learn about the tools stated previously, and that can help get children the help that they need sooner than later. And we're in school from ages roughly 5 to 18. That's a major part of our lives. And using this time to incorporate such an important topic can possibly decrease the number of cases of mental health illness and diseases and possibly save a lot of lives. So, in conclusion, mental health should be a part of the school's core curriculum because it could possibly save many young lives. It can help spread awareness, teach students about available tools, and it could lessen the cases of mental health in young people. So mental health is all around us, and will you make an effort to help spread awareness?